Hey everybody, Dr. Dave here. Just wanted to give you a little bit of video, further detail about some of the videos that you've been watching regarding this patient with nasal myositis or nasal slash sinus maggots. I figured it would be useful to, or more educational, to have a little bit of context as to what you've been seeing. So this patient presented to our emergency department a number of days ago with increased facial swelling, lip swelling, and some bleeding from the nose. This started to get much, much worse about a week ago, which time he was in the Dominican Republic on vacation with his wife. Uh, as this started to get worse, the patient decided it was time to get out of there, get home, and get some medical care. His wife had noticed that there was an odor about him or his nose that he was not really able to fully appreciate because he had had a previous history of a cancer many years ago within his nose that was removed, followed by some radiation. So his sense of smell was not fantastic. So he presented at a different hospital, was transferred to us for more specialized care, with the preface that he had a nose or lip abscess, a pus collection. We looked at the scan, it sure enough looked like there might be a fluid collection there that was going to need to be drained. So when I entered the ER to see him, immediately noticed he had a lot of facial swelling, some blood tinged mucus from his nose. And so I was planning to make a little cut underneath his lip to drain this nasal slash lip abscess. Had I done that, we would have both been surprised because we would have encountered maggots and not pus. And so, fortunately, he continued to report he had nosebleeds. And so we took a little camera. We peeked inside there, immediately noticed some creepy, crawly things inside his nose that were moving around. I remarked to his wife, it looked like there was something that was probably alive in there. At which point, his wife remarked to me that the day prior to him coming to the ER, he had noticed something fall out of his nose into his mouth that he felt was moving around. And so he spit this out, and it looked like a white, crawly worm. That'll make your stomach turn. So, immediately sought emergency care. By the time we saw him in the ER and saw these things inside his nose, we immediately decided it was time to go to the OR to get this fixed. And so I'll walk you through a little bit of this video here. So at this point, we weren't sure how best to potentially remove these. So we went inside with our scope and a suction, a large suction, hoping to potentially just suck these maggots out. Clearly that was going to be challenging because it looked like a lot of these maggots were at an advanced age where they were large and bulky and probably had been feeding there for quite a while. There was also quite a bit of debris, as you can see in there. I'm not a parasitologist, but what we've come to find out is larvae tend to shed their skin as they morph. They also, unfortunately leave excrement or poop inside there. And so you're going to notice a lot of kind of dead debris. I'm sure that's also encompassing some of the skin of the maggots and their excrement or poop. And in addition to that, what you'll notice is these maggots are very much kind of suctioned to the tissue. They're burrowed in to the soft tissue or even bone. So, mistakenly, I thought we'd be able to just suction these out and they would come very easily. That was not the case for the majority of these maggots, unless they were out wandering around looking for a new feeding spot. So, needless to say, we attempted to remove as many as we could via suction. There was a lot of debris, some serous and sanguineous type of drainage in there. But long story short, we found that suction was not going to be the best way to go forward here, and that we were going to need to use some different instrumentation there. What you'll notice in the large portion of the video, these maggots are everywhere. They've destroyed a lot of tissue, have wreaked havoc. And what you may not be able to appreciate is they were coming very, very close to the eye and the brain.